Blood in the semen. Do not worry. Come and learn about the causes, symptoms, and treatment. Blood in semen, causes, symptoms, and treatments. Blood in semen is called haematospermia. Find out possible causes and when to see a doctor. While finding blood in your semen, also known as haematospermia, can seem worrying, it's often easily treatable and is usually nothing to be concerned about. However, if you do discover blood when you ejaculate, it's best to visit your GP, to uncover the cause and start a course of treatment, if required. What will blood in my semen look like? Blood in semen is usually in the form of bright red streaks, says Dr. Riccardo Di Cuffa, Director and GP at your doctor. When it looks like this, it's as a result of a fresh bleed. Blood comprising clots, or blood that is darker brown in color, indicates an older bleed. You might also notice that your semen is stained pink in color. Why is there blood in my semen? Blood in the semen is called haematospermia or haemaspermia. When men ejaculate, they typically don't examine their semen looking for blood. So it's not known how common the condition is. Causes of blood in the semen. Seeing blood in the semen can make a man anxious. Fortunately, it doesn't always signal a major medical problem. For men younger than 40 with no related symptoms and no risk factors for underlying medical conditions, blood in semen often disappears on its own. Blood in the semen can come from several different sources. Infection and inflammation. This is the most common cause of blood in the semen. Blood can come from an infection or inflammation, in any of the glands, tubes, or ducts that produce and move semen from the body. These include prostate, the gland that produces the fluid part of semen. Urethra, the tube that carries urine and semen from the penis. Epididymis and vas deferens, tiny tube-like structures where sperm mature before ejaculation. Seminal vesicles, which add more fluid to the semen. It can also come from an STI, sexually transmitted infection, such as gonorrhea or chlamydia, or from another viral or bacterial infection. Infection and inflammation are the culprits behind nearly 4 out of every 10 cases of blood in the semen. Trauma or a medical procedure. Blood in the semen is common after medical procedures. For instance, as many as 4 out of 5 men may temporarily have blood in their semen following a prostate biopsy. Procedures done as treatment for urinary problems can also cause mild trauma that leads to temporary bleeding. This usually disappears within several weeks after the procedure. Radiation therapy, vasectomy, and injections for hemorrhoids can also cause blood. Physical trauma to the sex organs after pelvic fracture, injury to the testicles, excessively rigorous sexual activity or masturbation, or other injury can cause blood in the semen. Most of the causes of blood in semen are benign and not serious. The most common causes of blood in semen are prostatitis, which is an infection or inflammation of the prostate, or vesiculitis, which is the inflammation or infection of seminal vesicles glands that produce fluid for ejaculation, he adds. Sexually transmitted infections, such as gonorrhea and chlamydia, can also cause blood in semen, as can recent surgery or a trauma. Genital herpes and trichomoniasis are other STIs that may cause this. Having severe high blood pressure. A bleeding disorder, where your blood does not clot properly. In some hematological cancers such as leukemia or lymphoma where ability to clot is affected. A form of cancer, such as bladder, prostate, or testicular cancer. Rarer causes such as TB or schistosomiasis. Having seminal vesicle calculi, which are small stones in the seminal vesicles. But for men 40 and over, chances are higher that blood in the semen needs evaluation and treatment. This is especially true for men who have repeated episodes of blood in the semen, have related symptoms while urinating or ejaculating, are at risk for cancer, a bleeding disorder, or other conditions. Obstruction. Any of the tiny tubes or ducts in the reproductive tract can be blocked. This can cause blood vessels to break and release small amounts of blood. The condition called BPH, which causes the prostate to become enlarged and pinch the urethra, is also linked to blood in semen. Tumors and polyps. One review of over 900 patients with blood in semen found only 3.5% actually had a tumor. Most of these tumors were in the prostate. Blood in semen, though, can be linked to cancer of the testicles, bladder, and other reproductive and urinary tract organs. Men, especially older men with risk factors for cancer, should be evaluated if they have blood in their semen. Untreated cancer is a life-threatening disease. Polyps in the reproductive tract, which are benign growths that don't cause any medical problem, can also cause blood in semen. Blood vessel problems. All of the delicate structures involved in ejaculation, from the prostate to the tiny tubes that carry sperm, contain blood vessels. These can be damaged, resulting in blood in the semen. Continue reading below. Other medical conditions. Markedly elevated high blood pressure, HIV, liver disease, leukemia, and other medical conditions are also associated with blood in semen. As many as 15% of cases of blood in semen can't be traced to a known cause. Many of these cases are also self-limiting. That means that the blood in the semen goes away by itself without medical treatment. What should I do? If you find blood in your semen, visit your GP, who will start to determine the cause and whether further treatment will be required. They will ask how often you have experienced this and ask about other symptoms. Your GP will assess your symptoms, age, and medical history, as well as taking your blood pressure, and conducting an examination of the testes and abdomen, says Dr. Di Cuffa. A rectal examination may be required, and a dipstick of urine may be done and blood tests booked, to rule out a sexually transmitted infection, STI. The outcome of these tests will then determine whether you will need further investigations. If you are under 40 and have only had 1 or 2 incidents, and if all other findings are normal, it's likely that you will be monitored with instructions, he adds. If you are over 40 and your symptoms are recurrent, you may need a referral to a specialist. If there is anything in your history, examination, or tests suggesting a potentially serious underlying cause, you will also be referred. If so, this would be to a urologist who treats problems of the urinary system. If it is thought to be due to a simple urine infection, you may simply be treated with antibiotics. If it is thought linked to a STI, you may be referred to a sexual health clinic for treatment and contact tracing. Any high blood pressure will be treated separately. Blood in semen treatment. Your treatment plan will depend on the results of the investigations. If it's an infection or inflammation, antibiotics or anti-inflammatories will settle symptoms most of the time. If the problem is more serious, the urologist may investigate with ultrasound scan and possible biopsy of the prostate gland. Most causes of haematospermia have no effect on fertility, unless the cause is certain sexually transmitted infections that can affect fertility in some cases. If you have had a recent prostate procedure, any associated haematospermia should resolve within 3 to 4 weeks, but keep your doctor or nurse informed.